And welcome to the next session on the magnetic imager and how to use it. And if we could have the session objectives, learn how to interpret, that should say, the appearances of the magnetic colonoscope imager, learn how to effectively employ the magnetic colonoscope imager across a variety of real-world situations, and demonstrate how using the imager can enhance the performance of even the best colonoscopists via rapid identification of the cause of non-progression.
So you get the summation of the two images together is much better than having just one. And people like one for simplicity, but I'd encourage you all to use the split view. So the split view is where you have the anterior, posterior, and the lateral view. And this will give you much richer information. And if you think about why we're trying to reach the we're trying to achieve during intubation, we want to do it as many times as possible. We want to do it probably as efficiently as possible, and that translates into speed, so you're quick, but equally you want to be safe. And you ask the patients, it wants to be painless, and it's not just the patients who want it painless. Trust me, the endoscopist also wants it to be painless, so you have a calm, controlled environment. And I think this technology not only allows you to help understand the solutions to the problems you're facing, but also helps make the intubation much less uncomfortable. The last thing I want to leave you with is a lot of people regard this being a macho thing. I don't need the imager. Well, that's just for people who don't know what they're doing. Please think about that. You know, in this day and age, would you get in the car without sat-nav? Would you know what you're doing without Google? I suspect not. This is a technology that is designed to help you. And it's not a macho thing. It's doing the right thing and getting the right thing right most of the time. And without it, I'm afraid you are guessing. Thank you.
So earlier in the morning, one of my colleagues from Gloucester asked me to explain a reverse splenic loop. And here what's happening is this is the splenic flexure here. And what's happening is the scope isn't coming to the patient's right as it should do. It's going to the left and going backwards, then coming back forwards and round. And this is, if you keep pushing in, this is what happens to that appearance. And basically, what you need to do here is the same principle. You need to reduce the size of this reverse splenic, and then you have to apply a lot of anti-clockwise to bring this part of the scope or colon around in this direction. So anti-clockwise torque brings this round here and restores the scope into the right position.
So you've reached the cecum. We've had some discussion around this already during today, but you've reached the cecum and you've got one of these three images. On the left-hand side, this is the AP view. On the left-hand side, you've got the cecum that's going out laterally. In the middle view, you've got the cecum coming out anteriorly. And if in the right-hand view, you've got the cecum going in medially, so it's medial to the ascending colon. The imager here tells you what you need to do to try and either intubate the cecum more effectively or get the best possible view for the cecum. The most common scenario is 3. It's where the cecum comes in medially, and if the patient's in the left lateral position, then you're going to have fluid pooling in the cecum. As the fluid is going to drain down to the cecal pole, all the air from the cecum is going to rise up into the ascending colon. So what you want is to move that cecum more laterally, and you want the air to go into the cecal pole and the fluid to drain away. So that means moving the patient into the right lateral position. And we can see here that the pathology is identified by doing so, and the fluid is cleared. If we think about those other images that I showed, if the cecum is going off laterally, then you want the patient in the left lateral position. So the key thing here is that the magnetic